Okay, what happens when a patient has a chronic pyelonephritis? Chronic pyelonephritis means patient had many episodes of acute pyelonephritis in a turn with remission. When a patient has exacerbation of the chronic pyelonephritis, clinics is the same as in an acute pyelonephritis. Between exacerbations, between acute episodes of pyelonephritis in a chronic pyelonephritis, what can you find? Those periods are called latent period. What complaints may a patient have or has? The patient may suffer from a discomfort that happens in a lumbar part of his body. Cold wind provokes those complaints. Patient may have small, not so severe, small edema of his face, especially under his eyes or under her eyes. But this complaint is not so severe. It's like a very small edema that happens commonly in the morning. In the evening and before going to bed, there will be no edema in patient's face. If you take a blood test, what can you find? If a patient has a chronic inflammation, urine test, white blood cells level will be increased. Bacteria may be found, maybe not. Glomerular filtration rate. If the disease is not so severe, it may be normal. When a patient has an exacerbation, it will be lower. But if the chronic pyelonephritis is so severe that the inflammation goes into glomerular part, not only in the tubular part, inflammation goes further into glomerular part, the glomerular filtration rate will be lower. Reabsorption. Reabsorption is a marker of the tubular part of the nephron. In pyelonephritis, inflammation attacks tubular part. Reabsorption will be decreased. Glomerular filtration may be normal, but reabsorption will be decreased. That's why the density of urine will be decreased. Kidneys cannot concentrate urine. In a severe case, red blood cells may be lower because of insufficiency of erythropoietin. It happens when the inflammation goes to the glomerular part of the kidneys. But in most cases, red blood cells will be normal and white blood cells will be normal during latent period. What can you make? How can you be sure that patient has a chronic disease of kidneys, chronic inflammation of tubular part of kidneys, not a chronic inflammation of the bladder? You take an ultrasound investigation, and what you found? It's a normal kidney, normal structure. First, the size of kidney will be smaller because any inflammation leads to sclerosis. The size will be smaller. The structure will be deformed, a normal structure and deformed because inflammation leads to sclerosis. So architecture of the tubular part will be destroyed, will be deformed. White blood cells in urine, small size of kidney, the deformation of the structure, decreasing of reabsorption, and maybe bacteriuria, those are signs of chronic inflammation, infective inflammation of the kidneys. So you can know that the patient has a chronic pyelonephritis.